So we developed ADCOMS as part of a goal of achieving a scale that would be the most representative of the progressive items in an MCI stage of disease. And it ended up being a combination of the CDR sum of boxes, ADAS-Cog, and MMSE. And what that indicates is that those are the items that are really progressive in this MCI stage of disease. And we also tested it in mild, but it was actually developed in MCI. The LipidiDiet study was done in an MCI population. So this scale is really targeted to the aspects of disease that are most progressive relative to variability within that stage of disease. And by combining elements of the CDR sum of boxes and weighting them, and then adding on the ADAS-Cog and MMSE, you get better sensitivity to progression over time. And really, it ends up being a weighted version of the CDR sum of boxes, and the cognitive items are just giving it more precision by having extra points in between those CDR sum of boxes scores. So within mild AD, you're only using maybe 7 points or so of the CDR sum of boxes out of the total 18-point scale. And so by adding those extra cognitive items, you get more points in between those 7 points so that you can see progression that's happening in between those stages. And because it's aligned specifically with the MCI stage of disease, it allows you to see whether you're changing the most progressive aspects of disease in that stage. So with the LipidiDiet study, it was originally a 2-year study, and then they've gone on to continue collecting data longer than that and extending the study. So we now have up to 36 months of observation time. We're able to see that the ADCOMS specifically, and also the CDR sum of boxes, the pre-specified primary endpoint, continue to separate over that full 3 years of time. And ADCOMS continues to be significant. And of course, the sample sizes are getting smaller as people drop out and time goes on. You have fewer people in the study, but we have accounted for dropout in the analysis. And it seems that we're still getting separation all the way out to 3 years. And that's encouraging because it's showing that we have a pretty consistent slowing of progression over a long, long period of time. Now, the second way that we looked at combining outcomes in the study was a global statistical test. And that was combining for the primary 5-item NTB scale with the CDR sum of boxes and with hippocampal volume. And when we combine those three together, we see that we're slowing the progression rate across all of these different outcomes. And when you put them together, we really have a lot of strength of evidence for this treatment slowing progression. We did another analysis that also combines across endpoints. And the Bayesian hierarchical analysis is a little bit different than the global statistical test because it penalizes you if you don't have consistency across the endpoints. And consistency across the endpoints is suggesting that they're all measuring exactly the same thing. And in Alzheimer's disease, each of these different outcomes is actually measuring a different aspect of progression. So cognition is different than function, and that's also certainly different than hippocampal volume. And so by combining all three of these endpoints, we're getting a totality of evidence across the three. They're bringing independent evidence from different areas. But if we're really affecting the underlying disease with this treatment, then we would expect to see it on all aspects of disease progression. And so these three should be showing some consistency, not because they're measuring the same thing, but because they're all driven by an underlying disease process. So when we combine across all three of those outcomes, we get 0.008. So across all of these different ways of targeting as close as we can to the true disease progression trajectory, we get 0.045, 0.002, and 0.008. So we have quite a bit of evidence that we are having a significant effect over 36 months. And these three different ways of looking at it are three different ways of detecting whether it's really the full disease that we're slowing down. And it looks like we are based on those results.